What Drives You is brought to you by Ziglar, your premier source for equipping life and leadership coaches. Visit Ziglar.com and let them inspire your true coaching performance.
Yeah.
Welcome to What Drives You. I'm Kevin Miller, your host and guide to help you master your inner drive so you can live a driven, inspired, and peaceful life that sees you driving further and enjoying the ride. This is a What Drives Your Health episode, and we're talking about your thyroid. Your thyroid regulates much of your body, such as your metabolism and your growth and your development. Well, we as a culture are having more and more thyroid dysregulation. In this episode, we dig into what problems thyroid dysregulation causes within us, so you can hopefully ascertain if you are possibly being negatively affected. We cover how traditional medicine treats it, and then, of course, how my co-host, Dr. Randy James, would treat it from a functional medicine perspective, even down to nutritional supplements and recommended dosages. So here in America, so many people, again, suffer from hypo and hyperthyroidism. Though hypo is most common, and the result is feeling like the brakes are on in your physical health and you're pushing forward and feeling like you're in quicksand. So let's see if we can shed some light on this issue.
So, hey, before we dive into the topic, here's something interesting. You had done before last week, we haven't seen each other in about a week. You were on how many days of no wine?
I had passed over 2 weeks.
Really? Okay.
Yeah. And then we went to Kansas, and my parents don't. So there was another week of not.
Sweet.
Yeah.
Well, I did 4 days. I happened to do 4 days of nothing, no wine, no alcohol, no
During
nothing.
the camping?
No. Then I went camping.
Oh, yeah.
But my point there was to savor.
Yeah.
And so I had, over the course of that, I bought 2 different bottles of wine.
Over $20?
No. No, they were probably 12 and 15.
Okay.
Yeah. 12 and 15
I figured
bucks.
if you were going to, drink less and savor more, you would splurge a little bit.
But wait, I started off the savoring. So I was in around Canyon City, and I made an appointment, and I went into Holy Cross.
Yeah,
and did a wine tasting.
winery.
Holy Cross. I did a wine tasting. It was like 4 reds, 4 whites, and then they had some sweet wines I didn't even do. I didn't care to, but I did that and kind of played with my palate, and then got a couple Cabernets, and so I had that, and I savored it. So I sat around my camp spot by myself, out in the woods with nobody in sight, and I had rainbows and sunsets and savored my wine. Now, since then, I'm on day 7 again of no nothing, no alcohol, no nothing. And here's the 2 things that I realized. I definitely have more of a sweet tooth at night when you're not sipping wine. Then I'm thinking I'm wanting sugar. One, and my heart rate, my resting heart rate, is way down. So at our age, you don't even know if you pay attention to this, but at our age, I think, it's like 60 to 100 or something is the average heart rate. So 60 is the low end. My resting heart rate, just 24 hours a day, is around low 50s, is mid to low 50s is what I'm used to. You usually stay under 50.
Yeah.
Right? I'm under 50 now. My heart rate yesterday, my resting heart rate was 44. So it's down. And I had talked to a guy talked with me one time, and I talked about, times of no alcohol. And he says that when he stopped doing it, his heart rate went down significantly.
Sure. And I've noticed that too. And your watch does a little bit different than the Oura Ring, because it'll break it up for your sleeping heart rate average, and alcohol absolutely increases it.
Yeah.
And sometimes I feel like I can even feel it, that sense of pounding. A lot of people will have that sense of pounding, and it probably in my mind, but
I'm still falling asleep immediately. So that didn't
like a rock.
That didn't change like a rock, which is, I probably shouldn't, because now I'm struggling with having sugar late at night,
Well, did we talk about that? The sleep latency time, if you fall asleep too fast? Yeah,
we did. We posted it. Somebody talked about it online as well. So it's just interesting. Well, hey, so we had somebody who asked about, it was actually an iTunes or an Apple Podcast review. And somebody gives a 5-star review and asked about some certain topics. And one of them was thyroid issues. And so you said, let's talk about that. I'm not the doc. I don't have full understanding. So here, for layman's terms for everybody, the thyroid, this is off of WebMD or something, is a butterfly-shaped gland that sits low in the front of the neck. Your thyroid lies below your Adam's apple and along the front of the windpipe. So here's just elementary questions. When you have thyroid, well, and I also then just typed in thyroid, and you just type in the word thyroid and you don't get definitions necessarily. You get all this stuff. Here's what popped up. In Google, how it does this, it'll give you the leading questions or the leading searches. How do I know if I have thyroid issues? What are early warning signs of thyroid problems? How does thyroid affect the body? Is thyroid a serious problem? What is the best drink for thyroid? I don't know. How can I check my thyroid at home? At what age do thyroid problems start? What foods are bad for thyroid? And what causes thyroid problems in females? So there's the world out there.
There's the Google questions.
Yeah. So I'll let you hit on, kind of that layman's term of thyroid issues. And one of the places I wanted to start is, how does traditional medicine generally treat it?
Yeah. So this is a big topic, and it's a good topic, and it's one that I like. So this is within the realm of hormones. So a thyroid is a hormone. And yes, it's that gland on the front side of your neck, and you usually can't feel it. And when you go to the doctor, we'll do a thyroid exam and trying to feel for a nodule, which is not that uncommon and ought not be there. And a big one is called a goiter. So some people then, once you start to see it, and that's not that uncommon either, then and the word goiter is just, the word for nodule that is from an old word. And these days, the reason I think we're seeing a return, like I would even say we are in a thyroid problem epidemic, that it's approaching 20 or 30% of adults that would be on the spectrum of a thyroid abnormality. Now, remember, we always say we're all on the spectrum of everything all the time. So Kevin Miller's thyroid is not as perfect as it could be, but there's no indication that we have that it would be I can't remember. Yours might have been.
I had some
yours was
dysregulation.
Like just reading the labs through that lens, we'd say, oh, it's on the low side of where we would kind of like it to be.
Well, let me point that. So on your advanced lab, so if I went to a regular doc and had regular labs,
they would
probably wouldn't show anything. On your extensive labs, you saw some stuff, said, there's some things going on over here, even though I was not necessarily experiencing
the symptoms,
a manifestation of that. So you say an abnormality. And again, I love that perspective of, here we are going along, especially in our American culture, doing things that are less than perfect, eating, in ways that aren't perfect, sleeping in ways, stressing imperfectly. And one of the manifestations of that, imperfect lifestyle. I mean, we've got manifestations of dementia and high blood pressure and diabetes. Here's a manifestation. Okay. Right. Can I say that?
Yeah.
And yet,
sure.
If we said diabetes, you would say, okay, there's a manifestation. And one of the primary culprits of that is sugar.
Sure.
Can we say that?
On the thyroid side, you're going to have to say there is a stronger link towards genetics. Oh. So genetically, there's going to be, if you're, and probably more female. So the numbers are going to be there more often in female, and more often if there's a clear genetic pathway. So those things are true. But at the same time, absolutely, it's lifestyle related. One of those things, interestingly, is concrete, because do you remember the main mineral that we look at, that there's a deficiency of this mineral,
magnesium,
that is connected to thyroid? That one is related as well, but the main one is iodine.
Oh.
So when people go to the doctor and they get a test for, the TSH, thyroid stimulating hormone, and sometimes there'll be a T4, and then there's T3, T4, and there's technically T2, T1, T0, but the only ones we talk about are T4 and T3. And the 4 and 3 mean how many iodines are stuck onto a thyroxine. And so 99% of all iodine in your whole body is right there on your thyroid. And that's the gland that's using the iodine. And that's what the thyroid molecule is it is heavily related to iodine.
Would you have put me on iodine?
No, the next thing we would have done is test your iodine level to see if you're adequate.
I think we did.
we use the ZRT lab, you pee on a stick.
Yeah.
So a lot of people our age have grown up with the idea, and let me just ask you, is salt good for you or bad for you?
The thought was bad.
Yeah. So
until you one time said that it was at a time when I was, beyond super clean, I think. And you said, I don't know what was happening, but you said, you might need to add some salt.
Yeah. Because a lot of people in our generation, so our parents are sort of the boomer generation. And so many of them with high blood pressure, high cholesterol, and it just became this idea of low salt. I eat low salt. I'm really healthy or whatever. And I would say, okay, if by that you mean you don't eat processed sodium that's in prepackaged food that has a high sodium content, great. But if by that you mean you're not salting anything ever, then you're going to be salt insufficient.
Right.
And why do I bring that up? When I say, well, what is the main source of iodine?
Salt.
Iodized salt. So it's iodized.
Which I had to started paying attention to as well, because you can go and just, we'd grab the thing of salt to fill our salt shakers, and they're down there on the shelf at the grocery store, and some say not a sufficient.
Right. Not a dietary source of iodine.
Yeah.
So people then buy, if they have a little money, if they're on the well-to-do side of things or healthier side, then what kind of salt would you go and get?
Oh, like the sea salt.
Sea salt.
Yeah, like Mediterranean, the pink sea, yeah, whatever.
Well, and then Himalaya salt does theoretically have minerals in it, but not a measurable amount of iodine so that you can know.
Huh.
So not saying that the pink salt is not right or good or whatever, but it's just not going to be, especially the Himalayan salt, it's not going to be labeled.
Yeah.
And then your Morton's iodized salt is going to be iodized and if you do that, and salt to taste, then you're going to probably be okay. But so many people don't, thinking that it's a healthy thing, or they use sea salt because it's maybe healthier or something like that. So now we're having this uptick of goiter, of thyroid nodules, and of thyroid dysfunction. So that's just one of the reasons.
Well, I wanted to ask, what does the thyroid in its healthy state, what is it there to do? And the only reason I would ask that, it seems like a stupid question, because I'm not going to ask, what does your arm do? Well, duh, we know that. But it's one of those things that I learned while being here that, you can have your thyroid removed, which I knew, we have a mutual friend who did that. Plenty of people think, well, son of a gun, what's it supposed to do that now it's not going to do once it's removed?
Yeah. So your thyroid is often called the master gland, and it kind of touches everything. And so the way I think about it is your thyroid makes systems go. So it helps your eyes to water. It helps your skin to oil. It helps your heart to beat. It helps your bowels to move. So it gives gas to the systems to help them go. And it's, so by the same token, it also helps things to not go. So there's a gas part of it and a brake part of it. And so when people then need to maybe slow down and sleep 9 hours a night or 10 hours a night or whatever, you might feel tired. And your thyroid can be related to that in a good sense, because there's a protective. Yes, you feel tired because you should go to bed on time. Don't do another 6-hour night in a 18-hour workday. That's going to hurt you over time. And so like we've talked about so many times, we're probably under iodined. Oh, and the other key minerals that we need to mention. So selenium is the next one. So selenium is not one we measure in labs and stuff like that, but it's one of those things that is probably insufficient in most American diets. So selenium is on the low side. And then the next layer down, magnesium and zinc.
Where do you get selenium?
Well, famously, Brazil nuts. How often do you eat those?
Rarely, because you get the thing of mixed nuts and there's like two of them.
There's two of them in there. And people don't just walk around eating Brazil nuts. So you get it from your vegetables and nuts and plant-based foods. Okay. And it's one of those things that you think about, okay, I eat a pretty good diet. Am I getting enough selenium? We don't have a feedback loop for that. The labs, your insurance company is going to call it experimental. And even if you did do the labs, we don't have massive amounts of data that say this is the right amount of selenium to have. So it's one of those question marks, but I would perceive it as a question mark on the side of we're probably on the low side. So here we are. We're in a world where thyroid abnormality is pretty darn common. In fact, at a family gathering, my sister asked me about, what should I do? I think my thyroid's low, and it's a big topic. There's not just an easy answer to that. Let me go back to, what does it do?
Well, okay. What does it do?
Gas and brake.
Okay.
So
a regulator.
Yeah. It is a regulator. Remember the old 1970s equalizers on a speaker?
Yep.
And up, down, up, down, up, down, up, down. That's kind of your thyroid.
Okay.
Helping your heart beat a little bit faster this moment, and then a little bit slower the next moment, a little bit faster. And depending upon the 1,000 million variables going into the body, here you have this hormone gland that's sort of touching all of that. So when somebody becomes then hyper or hypo means that the gas is on. Okay. So your heart beats too fast. You feel too awake. You can't fall asleep. You're too jittery on the inside and shaky and maybe tremulous, and your bowels move too fast. And so there's diarrhea, and your skin becomes too oily. Your hair grows too fast, so it's too fine and thin and maybe oily. And hypo then becomes the other side.
Brakes on.
Yeah, the brakes on, and literally. And so hypo is the main problem in America, and people feel like they're driving with the brakes on. It takes more effort to do what I would normally do. I need to sleep 10 hours and I don't wake up feeling rested. My hair grows slower or falls out. It's brittle. My nails are brittle and dry. They break. My skin is dry and cracky.
Can I ask about that? Because I was going to, again, just on the first, I'm interested you put the search in Google and you find out what people are looking for and what is being communicated out there. And so when it talked about symptoms, this is literally right off the top of the list: high heart rate, excessive tiredness, anxiety, weight gain or loss, body shakes, feeling chilly or overheated, trouble concentrating, and hair loss. Which to me, knowing as much as I do know, is frustrating, because I could say, well, you could attribute that to 1,000 other problems as well. So it doesn't help a lot. But from your perspective, from a functional medicine perspective, what are the telltale signs of a thyroid issue that you look for? You just mentioned them, I guess.
Yeah, and those ones there for sure. Temperature regulation is a big one. That's, I run too hot, I run too cold, or cold hands, cold feet. I'm ice cold hands all the time. Is kind of a classic.
Which, if you have women who are often manifesting issues at midlife, 40s, 50s, or whatever, and that starts to happen to them, their first thought is probably going to be, premenopause.
You have to also ask those kind of questions too. Yeah. And so temperature regulation, and oftentimes, yes, we're talking about thyroid and estrogen and whatever in the same breath. And we should be. These are hormones, and they're all communicating with each other. And it is that idea of the symphony, and everything in harmony or disharmony. I
feel like the hair loss one is one I hear from women, especially guys. Maybe they don't recognize it because they think, I'm getting old, losing hair, but women don't expect that to happen.
Right.
And I remember hearing that from a lot of patients, women saying, hair loss. Yep. That's scary.
Yep. Okay. And it is. And it's frustrating. It's frustrating because there's just as many women who might say, yeah, but I went, I had my thyroid checked, or I even took medicines or whatever, and it didn't help the hair loss. And hair loss is its own complex situation. So if somebody's dealing with this, well, again, what you said, or I think that I brought us into that a regular, diagnostic panel at traditional medicine, Western medicine, is hardly going to show anything that's going to relate necessarily to thyroid. Well, it'll check a TSH and a T4, usually. And so thyroid stimulating hormone comes from your pituitary, which is essentially inside your brain. And so the hypothalamus sends a signal to the pituitary, and the pituitary then responds to that and sends out thyroid stimulating hormone. So this hormone goes to your thyroid in your neck, and your thyroid gland then responds primarily with the production of T4. And that T4 then ships out around the body, and it's kind of the traveling vehicle, if you will, and then it gets to the various tissues. So most of that T4 is converted to T3 in liver and kidney, but each tissue is going to convert that in its own way. And so some people have a problem with T4 to T3 conversion. And that's not that uncommon. So your TSH and T4 can be just fine, but if the T3 is low, and so I would argue you need to look at it. You do need to measure it. It's not, everybody, but it's certainly common enough that it needs to be looked at. And that's where, and I don't know why normal docs don't often do that. And if the TSH is fine, T4 is fine. And so that's what my sister said. Well, and a niece at the family gathering. And they said, well, the doctor said it was normal. I'm like, well, yeah, but what does that mean? What does normal mean? It is certainly normal in America to be tired and overweight and have headaches. So that's normal. And I would start there. If hair loss is there, if any of those kinds of symptoms are there. So every one of our patients, we're going to do a thyroid, right? Okay. Because those symptoms are just so common. And TSH, T4, and I would do the free T3. So an unbound.
Can somebody just go to a traditional doc and ask for that though?
You can ask. It's just going to be, what's the perspective of the doc? Do they agree with that assessment modality? Do they agree? And do they know how to interpret the results?
Is that something someone can go online to?
Yeah, you can. In America, you can get nearly any test you want.
So go to any lab test now.
Any lab test now.
Quest,
Life extension.
Yeah.
I don't think Quest does the
Quest.
Full
You got to have a doc.
panel.
Okay.
And there's companies galore now that will sell you these things, but they're kind of pricey. And then the real question is the interpretation. How are you going to interpret it?
Interpretation and treatment. And so how is traditional medicine treating thyroid issues primarily?
So if your TSH is elevated, and now it's debatable, well, what does elevated mean? And so I would argue TSH ought to be somewhere between 0.3 and 1.5, maybe 2.0. And I think LabCorp moved their upper limit of normal to 3.0. Quest is still at 4.5. Other labs are somewhere around there. In my career, so just 20 years ago, labs had it at 6.0, and so one was even at 10.0, which would be frank. Somebody's a poor woman is at 9.0. That is frank hypothyroid. As TSH goes up, your body's calling out for more thyroid, meaning, so even though the numbers go up, it's hypo. That gets people confused. So just remember that if the TSH is going up, your body is low in thyroid. And so somewhere around close to 1.0. And even endocrinologists, if they're treating it, they usually treat to 1.0. And so if that is above 3 or 4 or 5 or somewhere around in there, and you've got the symptoms, and the doc might say, okay, let's give you some thyroid medicine. And the name brand of that is Synthroid. The generic is levothyroxine. And that's been a subject of controversy for decades because many women would say, I need Synthroid. I can totally tell the difference if I get the Levo. And then people would say, oh, it's all in your head because generic it is the right medicine. It's the same thing. And no, I can totally feel better on Synthroid. And in fact, we should do a show on this topic too, but there is a significant, and I did not believe those women either in my early years. So in the zeros, I would just, try to tell them it's all in your head. It's the same thing, whatever. It's very frustrating, but there is a massive problem with generic drugs in America. Did you and I talk about that?
No.
Oh, that is something that people need to know about. Where are generic drugs made? Where would you guess?
China.
Mostly China, India, Indonesia. How much oversight do we have over those generic manufacturing
Very
players?
little, I'm
Zero.
assuming. Okay.
Yeah. So what became one of the strengths of the American system of FDA, drug oversight, production in the 80s got largely farmed out to generic companies. And then through a complex system that goes into business and all this other stuff, the billion-dollar companies in India, China, Indonesia. And so now I've forgotten the numbers, but 80% or something like that. And then the one that hit the news was ranitidine, which is the generic for Zantac, had an actual carcinogen in it. So this is an over-the-counter medicine for heartburn with a definable carcinogen. And everybody's asking, well, how can this happen? So I would now recommend to people, if their thyroid is kind of hard to control and they still have the symptoms, then we'll go to name brand only, or
Well, I was going to ask, overall, are you saying better off with name brand?
No, what I will overall, no, I'm using a company now called Valisure, trying to use another pharmacy company that's going to validate that the generic is actually the generic, that the ingredients are actually.
Well, I'm going big picture now. And you said we should do a show on it, but I mean, overall and generic drugs, are you saying, be careful?
I would say be careful. Yes.
I mean, we don't do a whole lot of drugs, thank goodness, in my family, but if we're going to get ibuprofen, I'm going to get the store, whatever cheap brand over, I don't even know what the name brand is, but
Motrin or Advil or something like that.
Yeah.
And right now, if you look into, there's a great investigative journalist book. Her name was Catherine Eban. I forgot the name of the book, and it'll make you mad because it really removes trust from you to the industry. And if that trust is gone, then what do? And of course, you ask your doctor, and the doctor's not going to know about it. So we could probably do a show on that one. For thyroid, well, let's keep going.
So you say traditional doc is going to, here's the meds.
Going to measure those two things and start levothyroxine.
Okay. What are you going to do?
And so we'll measure TSH, T4, free T3, and reverse T3. And so the reverse T3 is where we're trying to get an analysis of how is the body putting on the brake, so to speak. If the reverse T3 is going up, it oughtn't to be too high. And so what would you guess are the main reasons why the body would be putting on the parking brake here to slow things down? Number one, stress response.
Okay.
So that...
a poor stress response.
Well, maybe not. Maybe you go crazy on a 4-day camping weekend and ride 20 miles a day and it's a good stress response that says, I need to rest.
Okay.
And you actually rest. That's exactly the body doing what you say, gosh, I feel it's what your watch is telling you. Like today's a low day, so you should recover more. Mm-hmm. Okay. Well, that is what the thyroid is kind of doing. And you should feel tired on a day that you should feel tired. If you shouldn't feel tired on that day, well, that's a different story. But stress. So now we live in a hyper stress world. And so, yes, you might be getting a thyroid response of people say, gosh, I'm tired all the time. Well, you need 10 hours of sleep, but you won't give your body that. So, of course, your thyroid is getting a little whacked here because we're just not responding to these signals like we should be.
Well, so let me ask on that, though, because that's the other thing that I remember with patients, women specifically, where I'm sleeping. I went to the doc, labs look okay. They tell me I should be fine, but I'm sleeping 14 hours a day and I am exhausted.
Right.
Is that a classic?
Right.
Okay.
That's probably now they've had a problem for a few decades, right? And it's just now to the point of failure.
Critical acuteness.
Well, now the thyroid is probably hypo and it can't respond. What I'm talking about is if your reverse T3 is going up, and you keep pressing on the gas, like I still got to produce. And you're like, I can handle it. I can cope. I can whatever. For another decade or two, you can. But over time, you can until you can. And so we don't want to wait until you can't and sleeping 14 hours a day and waking up tired. We want to know before then. And that's the value of the laboratory analysis in context. Not just your lab numbers are this means you need a pill, this means you don't.
Which I want to point out, which is why a lot of people, again, when I keep referring to the past, when you and I were partnered in the practice and I was participating in it, and people would so often get information like this and say, okay, can you just read a lab panel for me? I'm going to take this advanced diagnostic. Will you order it for me and not just read it and just give me the results? Or I'll go get it at wherever, any lab test now or somewhere online. And will you do that? And your answer was no.
No, it's flying blind.
Because there's some functional medicine doc says, good functional who will, but you don't because of context.
The story, not even the heart and soul part of the story, but also the story of the symptoms, how they came about, and it's the labs are just the labs. They're just numbers on a page, and they have to be interpreted within a context. Yeah. And that is especially true in the thyroid. So number one is stress. That'll put that reverse a stress response. That'll put that reverse T3 going up, going up, going up. And then number two is probably insufficiency in those trace minerals. So the iodine, selenium, mag, zinc, and of course, then you get this negative feedback loop, because if somebody's stressed out, we've talked about the brain-gut connection before, and if the body's stressed out, we don't allow it to prepare for digestion, and we're eating in the car, we're eating with our email, we're eating in front of a screen all the time, the body's not getting the signals for digestion, you don't digest trace minerals then. That's kind of one of the first consequences as trace mineral assimilation goes down. Well, then you got this vicious cycle of more stress equals less of those minerals equals less thyroid function equals the perception of even more stress. And you can sustain, normal American life for 10, 20, 30, 40 years, but so commonly in 30s, 40s, 50s, people say, I'm getting more tired, my temperature is dysregulated, all of those symptoms that we already talked about are starting to creep up. Is the thyroid related? Absolutely, every time, all the time. Is it causal? Sometimes it's frank causality. You've already flopped over into hypo, hyper, but it's always related to those symptoms. So it's that reverse T3 and T3 ratio that we want to see looking good.
What are you going to say to a patient where you have found out that they have dysregulation in their thyroid because we can always say, well, everything, sleep better, eat better, stress better. Okay. So it's always everything. Right. But on the affirmative action side, again, if somebody was dealing specifically with dementia or diabetes or high blood pressure, there's going to be some areas of affirmative action for you. You've already mentioned well, you know what? I did want to ask you, you mentioned, look at the 4 minerals. You said iodine, mag, what was the other? Zinc, and then
selenium.
And selenium. Do you want to, is it fair to ask you to give doses or, be in this milligram range? Because we can all go buy that stuff. But
right, the problem is, and we talked about
that's
this,
why I said I didn't know if it's a fair question. But you will do that with everybody should be vitamin D, do this much.
Yeah, we did do that with the basics and omegas and stuff like that. Just shoot for here. Remember, we don't have a biomarker feedback loop. We don't have a standard of care out there that says selenium should be this and iodine should be that.
But you are, for that patient though, you are going to tell them to.
We're going to make a suggestion. If there's indication of hypo, that's the more common one, hypothyroid, then I would say, that iodine should be at the 150 microgram or above. Zinc.
Microgram, milligram?
Microgram.
I know what that is.
Selenium, 200 microgram. And then magnesium is just all over the map. We're all kind of under magnesium. Then I would say, then we have to talk about magnesium citrate, glycinate, all that stuff. I would say,
okay, but if you have to then
I would do magnesium glycinate, 400 milligrams per day, and what did I leave off? Zinc at 30 milligrams.
Okay.
A day. I think that's also zinc glycinate. Would be just a general, somebody's like, hey, I suspect my thyroid, I'm going to do thyroid support.
So could that be something like you used to have vitamin B shots intravenously or whatever, right? And people would come, you did it to me one time. You said, let's just see, if you feel a big difference, great. So you gave it to me and I had nothing. You said, okay, you must not be deficient. That's an easy way to do it. And you have other people go, oh my gosh, I just got a new lease on life. Could you say the same thing? So if somebody wants to try this for 30 days and see,
really not. It's
frustrating.
It's very frustrating because by the same token, you don't get a shot in the arm feeling from your broccoli either.
All right.
But it's very, very good for you. We know that. And it's over time in a context. We wouldn't say, oh, you have cancer, here's your broccoli.
So if you're saying, okay, like right now, I literally at 50 years old, I'd say, I don't really have any negative symptoms that I'm aware of.
You would be the guy. We would do all that based on labs.
Okay.
And you were on
But if somebody's listening right now and they're saying,
they've got symptoms.
Oh, well, that's what I was going to ask. If they don't have symptoms, then maybe not. If you've got some of these symptoms, then do they say just this is
Well, this
for
would
the rest of your
especially
life?
be if they've got symptoms, it sure feels hypo, but the doctor says your labs are normal, right? And they feel a little stuck. Then if you did a thyroid support and 3 to 6 months, not 30 days,
All right.
3 to 6 months. And then there's Google's solution, and there's extra iodine that some people do, and thyroxine that some people do. There's all kinds of thyroid support formulas out there. And to be quite honest with you, by the time I'm talking with people about thyroid and they're sick and tired of feeling sick and tired, I don't see a big result from those things.
So you're going to add them in as part of the mix of.
Right. Like all of those things are also very basic and pretty darn good for everything else. I mean, except for maybe selenium.
Okay.
So we're already fiddling with those anyway.
Okay. So that's part of it. So back to affirmative action prescriptions from Dr. James.
Yeah. So certainly the basics, the foundation, like we always say. And then I would say, if you're doing sea salt, get iodized sea salt.
Okay.
Or Himalaya salt. But you're trusting that, you got the batch that has some iodine in it. Okay. Or eat like a Japanese person, which means a heck of a lot of seaweed and seafood, which we just don't do so much of that. But it is thought that the standard iodine level of an average Japanese person, because of seafood and seaweed, is very high.
Seafood, I mean, obviously.
And seafood means not fish. It means shrimp, scallop, lobster, seafood, not fish.
Really?
That's the difference, right? So fish they have some, but not a lot. But shrimp will have relatively
and yet
a lot.
I think a shrimp is kind of disgusting. They're like the cockroaches of the ocean.
And all of them are. Lobsters,
Yeah.
clam, bottom dweller kind of things are bottom dwellers.
Yeah.
And so it depends on your sourcing and how those things are fed, and all those kind of things are part of that question mark too.
Okay.
So if somebody's or if your mom had thyroid problem, your sister has thyroid problem, and you're like, well, I just don't want a thyroid problem, I'd say, well, there are some multivitamins out there that are going to be sort of thyroid supportive.
Okay.
That's kind of where I would land on the proactive side of things.
Well, so those are all what you're putting in your mouth and whatever. What about lifestyle issues? Is there anything other than everything?
The stress response that we all have stress. We're all on the spectrum of how excellent can you be on your practiced and trained stress response. And that's where Sabbath and rest and sleep and mindfulness and those kind of things are definitely going to be.
What do you do with this anxiety and the reality that we are not only all on the spectrum of how we respond, but we're also amidst a culture that's high anxiety. And even just that, think of it like pollution. It's out there. It does affect you. So how do you deal with this? Because you're saying thyroid problems, because people could real quick say, just meditate. Whatever. There's lots of things. But what can you do to bring your anxiety level down?
Yeah, that's a big one. And that is definitely the adrenal connection, what we call the HPA axis, hypothalamus, pituitary, the brain. That's your stress perception and response as that relates to the adrenals. And then bringing the thyroid into that, it's actually the HPA-TG axis. So HPA, hypothalamus, pituitary, that's your brain, adrenal. So that's your stress response, cortisol response on all of that. And then underneath that is the thyroid and then gonad. And people don't have to remember all that, but I would say that in America, we begin experiencing symptoms and frustration in the reverse of that. So if I go over to the high school over there, especially women, and say, okay, how many women in here have problems with their gonads? Nobody will say anything. But if I say, well, how about PMS? How about painful menstrual cycles? How about acne? How about an imbalance in the sense of hormones? 90% of them will say yes. So already by 15, and and then the medicines start.
Which I know that's the thing too. You're seeing where you would think this is a middle age or even after issue that you primarily see with women. You're seeing it younger and younger.
Well, I would say it's a middle-aged consequence because it starts when they're 15 and they cope until they're 35 or 45.
Okay.
And then they're like, I can't cope
But you're seeing
anymore.
some younger ones who are already getting wrecked. I mean, they're already having symptoms and manifestations.
Just today, I talked with John because 5 moms in the last month have, and you remember this, it's like, we're in, can we start yesterday? It has to be yesterday. And it's like, well, our next yes to that is 2 months down the road. It's like, no.
Yeah.
And it's all anxiety, depression, for just this area of frustration. And so, yeah.
It feels overall. So you're saying if we pick on America, hypo is the primary issue, which you said is the brakes are on. So you're pushing, you're not getting, coming forward, and you're saying, you gave some, minerals and foods and whatnot. You gave, dealing with anxiety, but it could sound like a back off. You need to stop and recover. If that's the case, how do you look at, because, I'm the exercise. I love my exercise. How do you look at that? Do you say, no, don't go out there and press anymore? You just need to recover. Don't push. Or is there a place for moderate exercise to help?
There's always, so exercise never goes off the table, right? Even if you're post-op, we're going to say, well, you got to get up and walk the hallways and go to the bathroom. So exercise is never nothing. But it might be modified for sure. And for sure, for people in hypothyroid and adrenal strain, we would say, yeah, now's not the time to do a PR and to push. And they say, oh my gosh, I used to be able to walk 5 miles and I felt great. And now it's a week of recovery. Well, now's not the time to walk 5 miles, right? But don't not walk at all. So that, again, in context, is individualized to that person. And a woman today has said, gosh, I do push-ups or whatever, but it's 2 days of soreness. Like, well, you can't do nothing, but don't push the envelope of soreness, but maintain. And that there isn't an exact right answer to that. How, when do you back off and when do you press? And that's a subtle, unique biochemical individual question mark. And I would say in the thyroid world, it certainly is going to depend on labs too.
Yeah.
And so in the hypo, so eventually that reverse T3 kind of comes up, but eventually if the TSH starts coming up and the free T3 is low, like it's not getting produced, either there's not conversion from T4, there's not enough iodine, there's not enough substrate, just iodine's not there, magnesium's not there, it can't keep up with the demands. And then at some point, and I'm quick to use a medicine, right? Because people want to feel better faster. And because of all the problems with people needing name brand or whatever, but in the 80s, 90s, and zeros, I tend to start off with a natural desiccated kind. So that's Armor or Nature Throid or NP Thyroid. So natural desiccated. So it's made from, I think it's porcine derived, pig or pork. And they're bred specifically for harvesting the thyroid gland, and then that gland is used to make a compound that then gives the body both T4 and T3. So that's
where can the average person
it's prescription
can they get that from their traditional doc though?
Yeah.
Okay.
They can.
So they need to request it?
Yeah. And then the doc might say, I don't use that stuff. That's alternative medicine is what I think most probably docs might say. You need levothyroxine. That's the way we treat this. And so I would use one of those first. Now there's problems, and you remember the recalls and things like that. And it's getting better these days. But for people who are very, very, what I would say brittle, they're very touchy. It's very hard to get it right and dialed in. And then I would tend to use what we lovingly call levo and lyo. So levothyroxine is the generic version of Synthroid, which is T4. And liothyronine is the generic version of Cytomel, which is T3. And so we would use a combination of T4 and T3 to that individual patient.
Okay.
And what I don't understand in the normal American medical world is the reticence to use T3. Because that is the active form of thyroid. Your free T3 is the active. That's what's doing the work. It's not T4. It has to get converted. And some people's bodies just don't convert very well. And that's why I think a lot of women just get very frustrated in this regard. And I'm so sorry for my profession.
Well, and to that, for everybody listening, to go in your area and look for, as always, for a provider who can help you.
Yeah, just talk to your own doc and ask the questions. And if they're receptive, maybe they will. And if they're not, I'd say, maybe, look around. Because somebody should be receptive to at least the discussion of that. And they probably might say, well, this is just the way I do it. And I don't have any other reason to do it any other way. And then at that point, lovingly part as friends and find a different doctor.
There you go.
Well, friends, thanks for tuning in as we all work to leverage the power of our unique inner drive and wake every day to our authentic, driven, and inspired lives. Thanks, as always, to my co-host, medical doctor and functional medicine expert, Randy James, Dr. James. You can find him at True Life Medicine. And if you appreciate this podcast, got value, please let us know. Give us a rating on Spotify or Apple Podcasts. Apple, you can leave a review. You can subscribe on YouTube or any social media at kevinmiller.co. YouTube, you can see the whole videos, which a lot more of you are doing these days. If you want to learn how to master your own inner drive, check out my book, What Drives You, on Amazon in about any format you could want. And until next time, stay driven.
Yeah.